Farm Bureau helps protect its members in more ways than you might think. They've always been the voice of agriculture in Arkansas, working on behalf of folks like me when nobody else would. And Farm Bureau stands for the values that Arkansas families care about. They've protected my right to farm and make a living, which helps everybody who likes food on the table. You know what they say, Arkansas counts on agriculture, and agriculture counts on Farm Bureau.
And welcome back to Capitol View. I'm David Goins.
I'm Roby Brock. We are joined by U.S. Senator John Boozman. He was elected in 2010. Welcome to our program. Glad to have you with us.
Thank you for having me. It's good to be in Arkansas.
Very good. Let's start, Senator. Obviously, we're in the middle of August recess, so not a lot of activity going on in Washington. When you guys go back after this recess, is anything going to get done? If so, what?
Well, we hope so. The Farm Bill, is hovering out there. That's something we're going to be working on really hard. The other issues that will come up has to do with spending, the debt, the deficit, so we'll have the continuing resolution to fund the government going into the next year. And then not too long after that, we'll reach the debt ceiling, and there'll be a big discussion about that also.
What do you see playing out in that? I mean, there's a lot of doomsday scenarios out there that there could be a federal government shutdown, that we could get to this level of brinksmanship we've seen in the past. What do you realistically see happening?
I hope that's not the case, in the sense, my concern with the continuing resolution, as opposed to some of the shutdown in the past, none of the funding bills have been passed this time, and so you really would shut down all of government. My dad did 20 years in the Air Force. I can remember when he was gone, my parents had enough to worry about without whether or not they were going to get a check, and it really does get to that kind of things with real people. So we're going to be working really hard to come to an agreement. Again, you have to worry about the debt, the deficit. These are simple truths. We've got to get that under control. And so there's going to be such that we're going to need some concession to go forward with the debt ceiling and the continuing resolution.
Can you give me an example of what type of possible concessions we're looking at?
I think we're going to continue to ask for, decreasing the size of government, decreasing spending. The deficit has gone down quite a bit this last year, but we're still looking at $600–700 billion. I can remember a few years ago, the thought of a $250 billion deficit gave you heartburn. You didn't see how you could do that. We've had $1 trillion deficits for the last 4 or 5 years. Now a $600–700 billion deficit, you feel like you're doing good. That just simply can't continue.
Let me shift gears. A little over a week ago, Congressman Tom Cotton announced he's going to run for the U.S. Senate, challenge your other counterpart in the U.S. Senate, Mark Pryor. 2010, you won over Blanche Lincoln by 21 points. That was the margin of victory there. Do you see this race being more competitive in 2014 between Mark Pryor and Tom Cotton, or do you think it will be another blowout?
No, I think it's going to be very, very competitive. I think it'll be fought over the issues, and the differences are very clear. And so there's going to be a lot of outside money that comes in that, and so I don't think money's going to be an object for either candidate. But no, I think it's going to be a competitive race. I think both are going to run hard. And then again, the voters will have a very clear choice regarding the issues.
Obviously, Congressman Cotton running very strongly against his opposition to the Affordable Care Act. Senator Pryor talking about his support of it. I know that was something you ran against Senator Lincoln, her support of it. But the positive aspects that Senator Pryor's talked about, specifically in the last 2 weeks, the idea of not rejecting people for pre-existing conditions, some of the positive aspects of that law, are those aspects that you agree with? And what's your thought on this thought of trying to repeal at this point?
No, I would like to repeal it. I think the idea that you lose your job, you lose your insurance, those kind of things, pre-existing conditions. We need to deal with all that, but you can do that without spending an additional $1 trillion in taxes. Right now, there's 20,000 pages of regulation. It's literally 7 feet tall and growing. The author of the bill, Senator Baucus, described it as a train wreck, and so that's really where we're at. So it's complex. We're seeing a new phenomena of people trying to beat the system by taking 2 full-time employees, making those into 3 part-time employees. April, 260,000 done that way. So and you don't have to ask me, ask your doctor, ask your hospital administrator, because we're going to lose a lot of our community hospitals throughout Arkansas. Ask the person that you work for or if you're an independent, working, or the corporation that you work for, it really has tremendous problems.
I'm still looking for a little clarification, though. This whole concept of repealing the entire law, where do you start back over again from? Why would you not just reform from some points where there are things that are working, keeping kids on, college-age kids on beyond their college ages there, closing the donut hole on Medicaid?
I agree with all of that, okay? But you can do it through the free market system. You do it by increasing competition. Tonight we'll see the Geico commercial, on this station or some station. We can buy our car insurance wherever we want to buy it. You can buy your house insurance wherever you want to buy it. The same should be true of health care insurance. That will lower the price. My barber's got 2 or 3 employees. He ought to be able to pool with 1,000 other barbers going to the insurance market, and force down prices. The other driving cost of health care right now is preventive medicine. There's no tort reform in this at all. We've got counties in Arkansas where they're not delivering babies because they can't afford the insurance that allows them to do that. So those are the things we need to look at. Do it through the free market system, but we do need to address the pre-existing conditions. We do need to address these other things. What we're seeing, though, is not that. Rates have gone up dramatically, and they're going to go up even much more so next year. So what we're seeing as a result of this law is increased premiums, increased deductibles, all of those things, with $1 trillion worth of taxes.
But just to play devil's advocate with you, though, those reforms that you're advocating in the free market were not happening before the federal health care law was passed. So there has to be, in some people's eyes, government pressure to make some of those reforms happen.
Yeah, no, and I agree with that totally, and we're there now. I think those pressures are there, and we understand that something needs to be done. On the other hand, that really was the mantra. Well, we got to do something. No, you've got to do the right thing. And I think that the consensus is in. This thing is unworkable. That's why the president unilaterally has, delayed the implementation of the government, not the government, of the business part of this thing till after the next election. But what we're going to see is, again, tremendous increase in premiums. And I think eventually you're going to have rationing and poor quality care because the system is going to bankrupt itself.
I mean, obviously, you're in a chamber here in the last minute or two that has not voted to defund the Affordable Care Act. Do you see any scenario? I mean, we're talking August 2013 through November 14th. It doesn't seem that's going to happen. Some of the perceived benefits of the law, if the market exchange starts in January, will go into place. I mean, do you see over time perhaps public sentiment shifting it all? And if so, I mean, does it seem it'll be in the direction of wanting to do what you're advocating?
Yeah, I don't think so, because again, we are seeing significant increases in health premiums now. As you look around the different states, and I don't think we exactly understand what's going to happen in Arkansas with the exchanges and just health insurance premiums in general, but you're seeing tremendous increases. And the people that are really going to pay through the nose are the younger people, because with the new law, you can't differentiate. That you have to basically provide coverage for everyone at about the same cost. So higher risk pools don't get charged a lot higher rate. Now that's good and bad, but the reality is it really is going to force premiums up a significant amount.
All right, Senator John Boozman, thank you for being with us this morning.